Hi, everyone. I'm Jill Aitoro with SC Media and Cyber Risk Alliance, and I want to thank you so much for joining us for one of our wonderful interviews for Women in IT Security 2022. I am joined today by Maggie Amato. She is a recipient of one of our veteran, cybersecurity veteran Women in IT Security honors. She is the Business Information Security Officer at Salesforce, and we are incredibly excited to have her here. So first and foremost, Maggie, I want to say congratulations.
Thank you so much. I'm super excited to be here, and I can't believe that I'm an honoree in this category.
Yeah, and yeah, I should know that, within the cybersecurity veterans, we created that category to really recognize folks that the experience of their career, they have seen and gone through different transitions tied to the market and have remained top of their game and have so much to offer in terms of their peers, but also the incoming generation. So that is what we like to honor for cybersecurity veterans. So again, congratulations for that. I want to start off actually with your title because, BISO is sort of a new concept, I would say. I know we started doing some reporting on what it really meant over the last few years. But, you tell me, what is the distinction between the BISO and the CISO from the way you look at it?
From the way I look at it, I feel like there are places that I have seen do it very well, and some places I've seen try and just not really grasp the concept of a BISO. So a BISO, their main role is to understand the business and influence risk-based decisions. So it's more than just, recommending products. It's really actually understanding the nuances that are in the business so that you can securely enable them to run their programs, right? To go to market. And being at Salesforce, we have multiple clouds, right? So we have MuleSoft, we have Click, like we have Slack, we have all these different clouds. And so being the CISO there, Vikram Rao, our Chief Trust Officer, he is over everything, right? Like all of the products, making sure that our whole company is managing risk, right, appropriately. And so we have the BISO role that actually gets into the nuances, right? Builds relationships with the business, understands what their use cases are, understands their long range plans, like where are they going? What do they want to be when they grow up? How do we get them there with security at the forefront? Right at the table, discussing like, how do we do this so that we do this properly in the beginning instead of having all this work back end with vulnerabilities and issues coming up later. And it actually brings more meaningful conversation to the table. And so I feel like a lot of leaders and executives understand the concept of risk. Yeah. And whenever you're a BISO, you influence both your stakeholder, right? Like your business partner, but then you also go back into your trust team, your security team, your InfoSec team, and say, hey, these are like, where are we going? Who do we want to be when we grow up? How do we help enable these, businesses to secure their products? Because that's what we are trying to educate folks on, right? Like bringing security to the table earlier on to have these meaningful conversations so that we're not running down P0s left and right all the time.
Yeah, it's interesting. It demonstrates kind of the evaluation of how security within an organization should be structured from a hierarchy standpoint, how the team can better be integrated. And I think companies, it's good these conversations are happening because, so often it was a little bit too siloed, needless to say. So,
absolutely. And then you have the granular policies, like one product may work for the enterprise, but the policies definitely need to be changed, right? Like what are the impacts of doing this over here? Let's sip the champagne before we roll it out to everybody because they all have their own nuances. And so that's where the BISO role, we call it going native, right? Like we report into the trust organization, but the BISO positions, like we spend so much time understanding our business partners that we actually feel like we are part of the business team.
Yeah.
And that's how we're treated and viewed. And so it's a lot of respect and trust that have to be built. Like that's, in order to influence, you have to, be authentic, to show up as you are. And you know what I mean?
Yeah.
And then you have to really build that trust and respect with people in order for them to value your opinion and to really trust you whenever, shit does hit the fan, because
Yeah.
that's everywhere.
It
So
does everywhere. So I wanted to take a look. You have a long career, as we mentioned, and you spent quite a bit of time in public sector. And, you had an experience there that I recall as a longtime reporter on the government IT side that I think is really worth sharing. I have to imagine really had an impact in terms of how you view your career. You served in HHS. I think if I'm remembering correctly, you were tasked with leading the Healthcare Cybersecurity Communications and Integration Center, which was a mouthful. And the whole organization kind of underwent kind of a very strange situation, and you kind of got caught up in that. So can you talk to me a bit about what happened?
yeah, this is like the first time I'm talking publicly about this, but it actually feels kind of like a relief. I know we were talking about that before. I feel like years ago I'd been like, I don't ever want to talk about this, but now that I am years away from it, being in the public sector and understanding, how government works, going through administration changes, going through the political cycle, going through budget, going through appropriations, and just figuring out how to get, your budget into Congress, and especially at HHS when all of the individual operational divisions like FDA and CDC and everybody are all individually appropriated by Congress. Like, how do you get them to talk to each other or work together? Right?
Yeah.
Like, there's no carrots. It's just all sticks. Like, we have to put, we were reporting up compliance to the White House. And so I spent several years at HHS really kind of like infancy in a BISO role, integrating teams that normally didn't talk to each other. So going to NIH, going to FDA, like meeting the incident responders, getting common tool sets put in, having them go to trainings, right? Like, boss of the SOC, first Splunk, like just getting some common, ground between these people in order to build trust, right? Information sharing in cyber is supposed to be automated and easy. And as you know, it really comes down to, if I trust you, I will send you information. And if I don't, I will not, because I don't know where that information is going to go, right?
Yeah.
And so having gone through and built relationships with all of these key optives, Medicare, Medicaid, Indian Health, all of them, it became very apparent that we needed a data lake. Like, we needed some kind of repository. So innovating, coming up with how do we do this, on a, crawl, walk, run government pace, but at the same time, catch the wave. Because if you don't catch the wave and ride it, you have to wait till the next cycle, right?
Yeah.
And so it's rapid fire, just how do we get this done? How do I get this done? Finding champions, and then having that visibility into all of these different vulnerabilities, just information on cyber, working with DHS and the AIS program, right? Trying to innovate in cyber, working in the White House on different challenges in tech. I feel like I ran the gamut of the whole public sector. I was hatched at MITRE, and I feel like MITRE was, where I got all of my government knowledge. And then going into, how do we share this information that we have gathered across HHS, right? We have medical devices and proprietary information and education and Indian health, sovereign nations, right? All of this information, how do we share it with the private sector? And so I was instructed to stand up this public-private partnership, working with ISACs and working with the private sector to just get information out, right? This was back when WannaCry was going down.
Yeah.
We had 50-bed hospitals in Michigan who just didn't know what to do. Who are they going to call? 911? What are they going to do? And so we spent so much time working with I mean, just fusion centers, state and local governments, having them, just be educated on what cyber is, who to call DHS, call, Secret Service, like these are the people, they will fly, they will help you, like we can do this. We don't want to be diverting patients at hospitals. And that's one of the things that I was so passionate about is the healthcare sector, right? I mean, in finance, right, you can get your money back, but in healthcare, like you can't ever get your life back. And so when I think about healthcare and cybersecurity, that was one of the driving mission factors for me, was like, how do I help people that can't help themselves, right? These hospitals that are billing the insurance companies for Band-Aids, but they can't bill them for cyber. So the other aspect of this is being a female in government, in technology, in cyber. Like if you did that little egg thing, you know what I mean? Like the little Dutch dolls. It's like we're kind of a rarity. There's not a whole lot of us. And so that's why finding champions was so critical for me in the federal space, is because if I didn't have that champion, my voice would not have been heard.
Well, and your voice needed to be heard. You ended up facing this situation where, it's so complex, but I know you and a colleague of yours were very abruptly reassigned. And it certainly derailed the situation that you were trying to build.
Yes.
And you weren't given a lot of explanation, and the rumor mill was going. So, tell me about that situation.
So once we started this program, which was a mouthful, it was effective. We were called to Congress, right, to come and testify about how great we were, like this program was, right? Like constituents were actually reaching out to their representatives and saying, hey, this program is amazing. It actually helped us, get back online within 45 minutes instead of 7 hours. And so we had gone before Congress to testify how the program was doing and how we definitely wanted more funding because it was going really well. We were doing this with like already, allocated kind of slush funds that were passing around in government. Just like, hey, if you're not going to take that headcount, I'm taking it. If you're not going to take that by the end of the year, I'm taking that, fiscal end dollars, and I will execute. I know exactly what we need. We found out that we were definitely competing against private sector. And we were also realizing that within the agency, private sector had basically their claws in the agency. And so there were times when our agency would be writing cyber playbooks or injections into cyber, type tabletop exercises for a private sector company. And I didn't understand, I was like, why are we doing this? This isn't right. And so I had to take it to my boss because I was like, I just can't sit with this. Like, I don't know why we're doing this. It just doesn't feel comfortable to me. And then as soon as we both took this to our leadership, I mean, at the detriment of myself, right? Like we were reassigned, we were said everything in the book against us. Like I had ethics issues, and I mean, I was sleeping with people that I didn't even know. Like that's what was reported, right? My boss, who was a man, wasn't sleeping with anyone but me, of course, right? Like that's the allegation. And so we became whistleblowers, right? Like we actually are still protected whistleblowers under Congress, and we can talk about this per the agency and everything, but no specifics, no names, anything like that. It was just trying to do what was right for the public, right? Like being able to do this for the public sector who cannot financially afford it on their own and has real life impacting consequences, knowing that a private sector company is using the agency to funnel them with contacts and with information, and then to go charge the private sector, right, the hospitals, millions of dollars to do the same thing the government I was able to do for free. Just sharing information, helping them understand their business risk, right?
Yeah.
Hospitals have a specific risk that providers don't have, right? I mean, sorry. Yeah, insurance providers don't have. I did that say that right. Oh yeah, payers and providers. And so it's just those things that I was so passionate about, and I had like the okay from the secretary, I mean, on down to go and do. And we were running in the secretary's operations center during WannaCry, like really in like working with the White House and DHS. And the other things that are not talked about is the policies, right? So congressional policy with CISA, and none of this had ever been litigated before. And so what do we do? And so getting on the phone with the attorneys and having them talk for hours at a time while hospitals are down because it's never been litigated before. And it's like,
Yeah.
this is not a technical problem. Like this is
No.
not a technical problem. And so, yeah, at the detriment of myself and my boss, at the detriment of himself, we blew the whistle, because in the sector, in the healthcare sector, they need the help so bad.
Mhm.
And the government can't continue. I think they have stopped, but providing private sector with a leg up to basically do things that the government should be doing, right?
Yeah.
I mean, the government can do this. The government has all
Such
the
a shame,
information.
too, because it was where, you were trying to enable services to be directly provided to the most vulnerable communities that
Yes.
basically exist. We're seeing that now, ironically, even more than we did then, arguably, in terms of the impact of them not having that support in those services. And like you said, I mean, what I find ironic too is there were lots of articles and headlines, media following the story about you all being removed, and yet the end of the story, to your point, was never really told. So I'm really glad you are now, and I'm glad we were able to do this, because
Yes, me too.
yeah, I mean, it is too bad. I mean, do you feel like it sort of drove you to say to heck with government and move on to private sector to some degree?
I truly miss that program and that
Yeah.
mission and that world where I was able to help people who were truly in need, who
Yeah.
couldn't help themselves. But yeah, I'm one person. I'm not going to be able to stand up to the entire executive branch.
Yeah. Right. Well, you
um,
tried. I give you credit for
I
that.
tried, and then I think being a female, I truly do believe that if I weren't a female
Yeah.
running the program, things would have been very, very different.
Yeah.
But that's something that I have learned.
Yeah.
I've definitely learned that government, public sector is its own political beast compared to private sector. I think the transition from HHS over to private sector, staying in the healthcare vertical, was a lot easier for me because I understood the ins and outs of healthcare so well.
Yeah.
And then being in a payer space, I was in the same opportunity to help the providers because of the information sharing and analysis centers that are available. But yeah, I mean, I personally feel like it's two different kind of games, right? It's two different worlds, but at the same time, all of the big stuff is the same. You get a new BISO, you get a new CIO. It's like an administration change, right?
Yeah.
I mean, you still have to manage risk. You still have to do your basic cyber hygiene. But the political game is definitely different. Being able to read people, it's much harder to do when everything's online.
Yeah.
Right?
Yeah.
I mean, reading a room is way easier to do whenever you're sitting there. You can feel the energy and you can see the looks and who's talking to who, and you can't do that because I don't know who's talking who behind the scenes.
Yeah, right. And now you're with Salesforce, as you moved on from that
yes,
frustrating situation from HHS. Do you feel like you got a fair shot? Like, you're doing incredibly well in your career. Did you have to explain what went down over and over again, or?
I did.
Yeah.
I did. And I feel like, I definitely feel like it took a career hit for me.
Mhm.
But I wouldn't have been able to live with myself had I not been like if I stayed silent. I
Yeah,
just wouldn't have been able to sleep at night. And
yeah.
blowing the whistle wasn't great. I mean, I lost my hair.
Oh,
It took a physical toll on me. But I mean, it also put a lot of things into perspective.
mhm.
Like I am one person and I need to do what I can do. And what do I want to contribute into this world? And that is to really continue to lead and be able to help others as I go. I
Yeah.
really want to be able to help minority voices be heard. I want to champion other women because I feel like I've seen it all. Like,
Mhm.
I feel like
Yeah.
I have seen quite possibly everything that you can see. I mean, servers being stood up in somebody's basement at their house, I mean, just like whatever.
Yep. Yep. Oh,
It's
yeah.
not surprising, but now that I've lived the life, I want to help. I want to help others.
That's
So
awesome.
yeah,
Well, thank you for sharing the story and the situation and your own experiences. Kudos to your subsequent employer, Salesforce included, for recognizing the talent and, to be honest, the nerve you had to stand up and say these things aren't okay. So that's great. And
thanks.
again, I wish we could talk longer. Such a
I
fascinating
know. It's a great combo.
conversation. But congratulations and more to come. We will definitely keep in touch.
Thank you so much. Sounds good.
Great. And everyone, please do go to scmagazine.com to see the full coverage of women in IT security and to see more about Maggie and our other honorees for this year. Thanks for everybody for joining us.
Thank you.